Okay, hi. My name is Maren Carrere, and this is the evolution of treatment practices for mood disorders. Okay, so my topic is the evolution of treatment practices for mood disorders with a focus on how psychological treatments have changed over time and how those treatments have reflected what psychologists believed about the mind. Why this matters is because treatment for mental illness reflects broader shifts in psychology, cultural, and scientific understanding. And past treatment practices have shaped mood disorders and how we understand them now. Okay, historical perspectives on mood disorders. Middle Ages to the 20th century. The Middle Ages. So I'm just going to be talking about a few specific things about the Middle Ages. So Greco-Roman concepts of melancholia was what they used to describe like depression and anxiety and any feelings of upsetness that these people would have. And they would call it melancholia. So the concepts of melancholia persisted everywhere, and they persisted in European and Arabic medicine. An Arabic man who was a physician said that melancholy is a feeling of dejection and isolation which forms in the soul because of something which the sufferer thinks is real but is actually unreal. The Arabs were noted particularly for their humane treatment of mentally disordered people. But the Christian church developed acedia, I don't know how to pronounce it, I'm sorry, acedia, one of the 7 deadly sins, which was similar to the idea of melancholia, but emphasized sloth and gluttony, which are 2 of the 7 deadly sins. And they kind of put this idea of melancholia or being depressed or upset a sin. They said that it was induced by demons, and women sufferers were at risk of being burned as witches. And some people did start to come up with different ideas for it. We'll talk about those ideas today. So the 16th and 17th century. So the humoral theory. The humoral theory was a big thing during this time. Basically, it came from ancient Greek medicine. And if you look at this, there are 4 humors. Each humor was believed to influence both physical health and like personality and like mental states. So blood was associated with, there's 4. There's blood, bile, black bile, and phlegm. So blood was you like taken out of someone's body if they thought that they had an issue with themselves, and we'll talk about that more. Yellow bile and black bile used to be also thought of as something that was connected to the mind, so they would make people throw up and stuff. We'll talk about that more later as well. Yes. And then demonic possession was a big thing. Obviously, I just talked about it. People used to believe that instead of a mental health illness or crisis, it was actually demonic possession. And then something about this, a person that was important during this time period was Timothy Bright. So Timothy Bright wrote a book called A Treatise of Melancholy, and it was, this was one of the earliest English texts focused specifically on psychological disorders, and he argued that melancholy was not simply like a moral or like spiritual problem, that it was an illness, and he said it was rooted in the body, especially in the brain. So this was one of the first times we saw somebody say that psychology and the way people acted was rooted in the brain. And then Robert Burton was another really important person during this time. Burton believed that he wrote a book called The Anatomy of Melancholy. So he believed that melancholy was really common and it could affect anybody, which other people didn't think so. They thought there was something really wrong with the person. But he argued that there were a bunch of different causes, humoral causes, and psychological causes such as emotions and grief and jealousy and guilt, and environmental causes like isolation or stress. And he was one of the first people to say this stuff. Okay, so the 18th century. The next slide's the 18th century. So we have the introduction of hemodynamic theories of the pathogenesis of depressive states. So basically what that means, because I had a hard time understanding what that meant also, is that basically that people started thinking that there was something to do with the brain and the blood and the body that had to do with psychology, which is true. So, but not in the way they thought it was. So one of the first people that I'm going to be talking about is Archibald Pitcairn. He was a medical professor in Scotland, and he rejected full humoral expectations and like explanations of psychology, which means he didn't fully think that it was only bloodletting and purging would help. But he did think that it was blood flow and how the blood circulated to the brain. And he thought that melancholia, the idea of melancholia and depression, came from thickened blood, which had a big influence on psychology because it helped shift explanations of mental illness from like demons and moral problems to physical problems, and it emphasized the brain. And then there's Herman Boerhaave. He was Dutch, and he was a teacher. He was often called the father of modern clinical medicine, and he believed that melancholia resulted from disrupted circulation and changes in the brain, and the influence this had on psychology was because it promoted looking at symptoms systematically and like really thinking about what's wrong with the person in a brain way rather than in a something's wrong with them in a different way type of way. He treated mental illness as a condition that could be like helped. And he emphasized patient history. So like other people wouldn't ask about the patient's history, but he did. And lastly, we have Richard Mead. He was an English physician, and he was a doctor to King George II. And his view of mood disorders was that he believed that melancholia involved circulation to the brain, blood circulation to the brain, and he helped support the idea that emotions and thought depend on nervous systems. Yes, so that, and then that's the brain circulation and how the blood actually does circulate to the brain. Okay, the 19th century. So we had a switch from melancholia to emotional insanities, because people believed that melancholia was too broad. Clinicians became frustrated saying that that was too broad of a term, and they split it up into different terms, because they said that melancholia technically covered normal sadness, like my cat died and I'm sad, all the way to extreme depression and extreme mental illness. And so they wanted to come up with different terms. So some of the terms they came up with, I just have some examples, are trichomania, lipomania, and pathetic insanity. And then they came up with categories for melancholia. So like melancholia with or without delusions, melancholia active or passive, melancholia simple or complicated. Just trying to come up with different ways to categorize everyone, which is the first time we see them trying to categorize different people and them seeing a pattern in that not everyone is the same and that different things are happening, but that there is multiple people it's happening to. And then the unitary psychosis hypothesis. Basically, the core idea is that all forms of mental illness are at different stages or expressions of a single underlying like brain disease. So instead of it being like depression, anxiety, schizophrenia, it would be like everyone has its mental illness is just one big scale. There's not different branches. It's just where are you on the scale. This basically just proves that at this time, people were trying to figure out how to categorize people, and like how to name mental illness and like starting to recognize mental illness as a real thing. Okay, now we're at the 20th century. Basically, Emil Kraepelin, his influence on psychology was that he was the founder of modern psychiatric classification. So he emphasized systematic observation and looking at people through a systematic way, and separating mood disorders from psychotic disorders, which was super important. He distinguished manic depressive from schizophrenia. And then Sigmund Freud, he was the founder of psychoanalysis. He shifted attention from unconscious processes, emotions, and early experiences, bringing in a lot more of the childhood idea, a lot more of how you were raised idea, a lot more of what you dream about and what's happening behind the scenes, behind what you even know, which had a big impact on mood disorders because he viewed depression as resulting from unconscious conflict and internalized problems, which is partially true. So, he introduced talk therapy and that type of therapy and like psychoanalysis as a form of care and help for people who were dealing with mental health issues. And then Adolf Meyer, he developed psychobiological approaches to care. He looked at the whole person, everything about them, and he really viewed depression and emphasized that depression was from a lot of different factors: life stress, the habits the person had, the environment they were in, and how they lived their life as a whole, as opposed to just something wrong with their body and their brain. He promoted psychotherapies and lifestyle changes, which is still applicable today. And then there was an introduction of physical methods of treatment, such as ECT, which is electroconvulsion therapy, which we'll talk about more in a second. Okay, so early treatment methods for different mental health issues. So, and how these treatments showed what psychologists thought about the mind and how they have changed over time. So, spiritual healing. Spiritual healing, such as prayer, exorcism rituals, those types of stuff. The time period for this was ancient times and Middle Ages, and it slowed down after that. And what it shows, some places, some communities still use it, but for the mainstream psychology, it has stopped. What it shows how we viewed about the mind. It shows that mental illness was seen as caused by spirits or religious sins, something otherworldly, something different, and that mind and body weren't connected. They didn't think that what was happening in your mind was making you feel this way. How this changed is that it was replaced by medical explanations connecting the mind and the body, and it shifted from spiritual to biological. Okay, trephination. That is when you drill or cut a hole into the skull. It was said to release evil spirits and demonic possession and relieve pressure for some people who had brain injuries. The time period was like in ancient societies, again, very early. it shows that we thought that mental disorders were caused by evil spirits again, and they were trapped in the skull. We didn't really know what was happening, but we thought that maybe it had to do with the brain. And it was starting to lean into physical problems. And how this changed is it was replaced by medical and biological theories, as opposed to that. Bloodletting and purging. So throwing up or using laxatives to purge, and then having that is purging, and then having a vein cut or like syringed so that you started bleeding out was bloodletting. So this happened from ancient Greece all the way to 18th century, and some people still do it. It's super rare. It shows that we viewed mental illness as an imbalance of bodily fluids, which is where the humors theory came in, with the blood and bile and phlegm. And it shows that we thought that the mind and body were connected through bodily fluids. And this changed because it led to the thought that physical evolved because it led to the thought that physical interventions could help mood disorders, and it got replaced by medicine later on. Okay, isolation and asylums. So locking individuals away in big facilities and housing the mentally ill. So the time period was mainly 16th to 19th century, but we have things such as asylums today, but they're mental hospitals. So it shows that we viewed the mentally ill as dangerous and scary, and that we'd rather contain them than cure them. And there was a big stigma. So old-fashioned asylums were very intense and scary. People would be locked away for life and drugged up and tested on. However, today, how we have changed is we have shifted towards therapeutic care. So as we learned more about psychology, we started caring for people in different ways and helping them more. And a mental hospital is more just a place they can get nonstop care for their mental disorders. Insulin coma therapy. So you were injected with insulin, and then you'd be put into a coma for a little bit, and then they'd wake you up by pouring this like sugary thing into your mouth, and you'd wake up, and you would do that several times a week for a while. This happened mainly the 1930s to the 1950s. What it shows about how we viewed the mind is that we believed that you could reset the mind if you like reset the whole body. And that this shows that slowly we started to really connect the brain and the body. And how this changed is it's been replaced by safer and more effective meditations and medications and electrocognitive therapy, ECT. And it was the beginning of like biological psychiatry. Metrazole therapy, inducing seizures through metrazole injection, which was this thing that they would inject you with and you would have a seizure. It was the same thing as the last slide. They believed that resetting the whole body and the nervous system could somehow reset your brain and cure you of all mental disorders. The time period was mostly the 1930s. And how it's been changed is we've changed it to electroconvulsive therapy and different modern medications. And it shows an increasing focus on how we started to believe that the brain was connected to the body. And lastly, a lobotomy. So lobotomies are the cutting or damaging connections in the frontal lobes of the brain, which you can see right there. What this shows is that we had a lot of biological determinism, which means we were very obsessed with the idea that we could do something to the body or to the brain or to somebody to cure them of their mental illness. This was mainly happening in the 1930s and 1950s. And it just shows that we thought mental illness was an anatomical problem rather than something psychological or social. And how this has changed is we abandoned it due to it had severe side effects and could make people severely handicapped and disabled. And it was very ethically wrong. But it paved the way for other treatments such as ECT and TMS. In conclusion, the way mood disorders have been perceived and treated throughout history have shaped how we view mood disorders today. Without the harsh past, we might not be as humane and empathetic as we are today. These treatments have taught us a lot about how psychology has developed throughout history and how treatment has developed as well. These are my references, and thank you so much.